Are you hearing all of the hype about weight loss medications like Ozempic, Wegovy, and Zepbound, and wondering just like what's true, what's not? Maybe you're curious if these medications could potentially help you with weight loss, or maybe you're completely against them altogether. Either way, this episode is for you. Today, we're cutting through the noise with science-backed facts and expert insights. You'll walk away with clarity on how these medications work, what the benefits and risks are, and why they're not magic, but they might be the right tool for some people. This is episode number 197, GLP-1 medications and weight loss. Everything you need to know. This is the Healthy Real Food Podcast. I'm your coach, Erin Hart, a registered nurse and health coach who understands the struggle of feeling out of control around food and has walked the path of transformation, experiencing the miracle of sustainable weight loss with the sugar and flour-free lifestyle. If you are a woman who feels powerless against your cravings and is ready to live your life with more energy, mental clarity, and purpose, there is hope. Here we believe that with God, a mindset of unstoppability, and consistent execution of a winning strategy, anything is possible for you. So if you're ready to find freedom from food addiction, take control of your health, and pursue your dreams with renewed energy, support, and accountability, let's go. Hey, my friend, welcome back to the Healthy Real Food Podcast. I'm excited about our topic today. I've had so many conversations lately with clients who are curious, hesitant, or even judgmental about GLP-1 medications like semaglutide and tirzepatide, and other clients that are starting to use them. There's a lot of confusion out there, some valid concerns, and also a lot of misinformation. Today, I want to walk you through what the science actually says and help you to make an informed decision if this tool could support you. I want to preface this by making it clear that I'm not a doctor. I encourage you to work closely with your doctor when considering any medications, especially medications for weight loss. I also want it to be clear that I'm not promoting these medications or against these medications. As we'll discuss, there are risks and benefits to consider, and that's an individual decision. I don't sell these medications or get any monetary benefit if you use these, but I've done extensive research on these because I want to help provide you with accurate and evidence-based information to help you to lose weight for the last time in a healthy, sustainable way so that you can feel empowered and know what questions to ask. So I put a lot of research into this episode. It's a little longer than our other episodes because I wanted to go more into depth with this hot topic. So let's talk about the science and history of these medications and the right way and the wrong way to go about using them for safe and permanent weight loss. GLP-1 stands for glucagon-like peptide 1, which is a hormone that we naturally produce in our bodies. It's released from the gut in response to food. And you've probably heard of brand names like Ozempic, Wegovy, Mounjaro, and Zepbound. These are the most common GLP-1 medications being prescribed today. Ozempic and Wegovy are both brand names for the generic drug semaglutide, while Mounjaro and Zepbound are brand names for tirzepatide. So while there are 4 names floating around, they actually represent just 2 medications with overlapping but distinct uses. The different brand names correspond to FDA-approved uses of medications. Ozempic is semaglutide, and Mounjaro is tirzepatide. They were first approved for the treatment of type 2 diabetes, and then later the same active ingredients were approved under new names, Wegovy, which again is semaglutide, and Zepbound, which is again tirzepatide, specifically for chronic weight management in individuals with obesity or people who are overweight with related health conditions. So these medications work by slowing gastric emptying, or In other words, the rate at which your food leaves your stomach into your intestines. They enhance satiety, that feeling of fullness, increase insulin secretion in response to your meals, and decrease glucagon production. So they're called GLP-1 receptor agonists because they mimic the action of our body's natural GLP-1 hormone, helping to regulate blood sugar and reduce appetite in a controlled and therapeutic way. So the short way to say that is that they work in your brain and your stomach to help you to not feel as hungry and to decrease your cravings. Tirzepatide, which is marketed as Zepbound or Mounjaro, mimic both GLP-1 and GIP, which stands for glucose-dependent insulinotropic polypeptide. Try to say that 5 times fast. So GIP, in addition to the GLP-1 in tirzepatide, enhances the effect on your appetite and metabolic regulation. And people seem to report that they get a little bit better results with that, but it's a little bit more expensive. So originally, these medications were approved for type 2 diabetes, but after giving them to patients for a long time, the drugs showed such significant weight loss benefits that they were recently approved by the FDA for obesity treatment as well. GLP-1 receptor agonists have actually been around since 2005, and they're not going anywhere. So we have a lot of data on them. Semaglutide was first approved by the FDA in 2017 for the treatment of type 2 diabetes, and tirzepatide followed in 2022. And because they saw such significant weight loss in the clinical trials, semaglutide was approved under the name Wegovy in 2021 for chronic weight management. And then tirzepatide was approved as Zepbound in 2023 for the same purpose. So these are not new or experimental medications. We have years of safety and efficacy data to support their use. Millions of people are currently on these medications. And unlike drugs like fen-phen from the 1990s, which we all remember, which were pulled from the market because they cause serious heart-related side effects, GLP-1 medications have been rigorously tested in large-scale trials and are considered safe when used as prescribed under medical supervision. So according to a 2022 STEP trial published in the New England Journal of Medicine, the patients on semaglutide lost an average of almost 15% of their body weight over 68 weeks compared to 2.4% with a placebo. In 2023, a study in The Lancet showed tirzepatide led up to almost 21% total body weight loss in people with obesity and no diabetes, which is significant. Other conditions that are treated with these medications, like we talked about, type 2 diabetes, it improves glycemic control so people can use less insulin. It helps people with obstructive sleep apnea. And the longer that they're out, the more they're finding other benefits. So they've been shown to decrease cardiovascular risk. For example, GLP-1 medications are not a magic pill for weight loss as it may seem. While they may be effective, they're often misunderstood and misused by people looking for a quick fix to weight loss without addressing the underlying habits and mindset that lead to lasting transformation. But for some people, especially for those who are struggling with food addiction, or for those who are striving to live sugar and flour free but are struggling to stay consistent with their healthy habits, these medications may be a powerful tool as you build healthy habits to support permanent transformation. The problem with these medications is that many people are using these medications to eat nearly nothing, and that's why they're rapidly dropping weight. That is not safe, and that is not what these drugs were intended for. Like we talked about, they decrease your hunger and quiet down all the food chatter in your brain. you have to be careful to use them in the right way. You don't want to become anorexic or to stop eating, right? You go from having the problem of obesity to the problem of starvation and malnutrition. So other people may feel like using medications means that they're weak or they're cheating. And that belief is rooted in the diet culture and shame, not science. So let's talk about how to use these medications safely and effectively. So, first, what not to do is don't use them without lifestyle changes and mindset changes. Don't view them as a cure for obesity, they are a treatment. Just if you stop taking cholesterol medicine, your cholesterol is going to go back up. Obesity is also a chronic relapsing condition. You don't want to use them as a way to starve yourself or crash diet. So that is a very real concern and a dangerous way to use these medications. Muscle loss is a serious concern. So when GLP-1s are used without diet and exercise, adequate protein intake, people can lose up to 40% of their weight from lean muscle mass, which is, for women over 40, that is detrimental because already in menopause, that's the fight that we have. In menopause, without medications or weight loss, your body naturally decreases your muscle mass and increases your visceral body fat, the fat that's around your organs, without any change in your diet. And that's why after 40, all of a sudden, you find yourself struggling with your weight if you didn't have a weight issue before because of the fluctuations in your hormones that come with age for every woman. So it's really important that we don't lose muscle mass when we're losing weight, that we try not to, right? Anytime you lose weight, it's not just fat. Like, you're going to have water and muscle and fat, but we want to really minimize the muscle loss. Muscle is the organ of longevity. Your quality of life in your older years depends on the amount of muscle that you have. So real health is to be strong, not just skinny. According to Dr. Josh Axe, losing 40% of your muscle could potentially take 20 years off of your life. If you've seen what they've talked about with Ozempic face, that gaunt, prematurely aged appearance some people display and celebrities display, and Ozempic butt, which is like a flat, sunken appearance of your glutes. And those are not direct side effects of the medication itself. They are signs of extreme caloric restriction and undernourishment. So, in other words, like, these symptoms of starvation and this muscle loss is not a side effect of semaglutide or tirzepatide. It's because people stop eating and they're undernourished. So many people who use these medications without also making sustainable lifestyle changes tend to regain the weight back when they stop. And the weight that they do regain is fat, not muscle. Why is that? Because, like any other diet, if you've been on that dieting roller coaster forever, losing and regaining weight where weight's lost without real habit or mindset change, people revert back to the way that they were eating before, and they don't regain muscle, they regain body fat. What I think would be really helpful for people who are using these medications is to get a DEXA scan or a body scan that measures not only your weight, but it also measures your body fat, your muscle mass, and your water. It just helps to differentiate what your weight is actually in your body. There's also the scales that you can just have at home that show that, but a DEXA scan is the best. So a DEXA scan runs, I think, $75 to $100, but it can really help you to know your current muscle mass, and then you can monitor that as you go to make sure that you're maintaining your muscle. So success with weight maintenance, whether you're using GLP-1 medications or not, ultimately depends on maintaining the habits that helped you to lose the weight in the first place. These medications don't burn fat or magically melt pounds. They work by reducing your hunger and quieting the mental food chatter that can make behavior change difficult. So that's why when people stop taking these GLP-1 medications without having developed solid routines, a supportive community, a mindset transformation, the weight rebounds. So I'm just going to say this again so that when these medications are used improperly, such as drastically under eating without enough protein or strength training, a large portion of the weight loss comes from muscle, not fat. Up to 40% of weight loss in these situations can be lean mass if you use these drugs to starve yourself. And that is not healthy weight loss. Then, when the medication is stopped and hunger returns, people overeat processed foods and regain weight as fat rather than muscle, leaving them in a worse metabolic state than when they started. So let's be clear, using GLP-1 medications without pairing them with healthy habits, mindset support, identity shift, and accountability is not a sustainable long-term strategy for weight loss. If your goal is to eventually stop taking the medications, which are expensive, you must approach it as a temporary aid to help you to build a bridge as you automate healthy habits and make lifestyle changes. Don't use it as a magic pill. But when used properly, these medications are amazing and can help reduce your hunger and your food chatter long enough for you to implement and create a new healthy identity with a healthy real food lifestyle. So when you titrate both your medication and you use the minimum effective dose and you adjust your meal plan, aiming for a slow, steady weight loss of no more than 1 to 2 pounds per week, this takes away your hunger and your cravings. It allows time for you to build habits, balance your macronutrients, eat enough high quality protein and calories, and incorporate resistance training consistently. And keep in mind that with these medications, you can't rely on hunger signals to eat. You have to think of food as medicine because you won't be hungry or be thinking about food. But because our food is weighed and measured, and we are focusing on the quality of our food, eating a balance of macronutrients of every food group, all the colors, like you know exactly how much your body needs, which really helps to prevent undereating. Without this structured meal plan, some people unintentionally just eat too little on these medications, which can lead to those symptoms of undernourishment and muscle loss. So once you reach your goal weight and you start adding food to help you transition to maintenance and stabilize your goal weight within a healthy 5 to 10 pound range, and you've established healthy habits and routines for grocery shopping and meal prep, once you are eating for purpose and not just pleasure and have automated habits supporting your sugar and flour free lifestyle, you can then hopefully gradually transition off of the medication and be successful long-term in maintenance. These medications don't replace the need for coaching and support. In fact, I think it makes coaching and support so much more important for people dealing with food addiction, people who feel powerless against their cravings and out of control with food. Taking these drugs without a full framework that includes mindset coaching, meal planning, community support, and accountability sets them up for either long-term, lifelong, potentially dependence on the medication, or a rapid regain of fat and reentry into that diet binge cycle. But if you approach weight loss with these medications as a tool to help you as you change your identity and start to implement healthy habits and a healthy, balanced meal plan, I think it could potentially be helpful for some people. So, how do you protect your muscle and your metabolism when you're taking these GLP-1 medications to prevent that muscle loss? Like we said, just like without using these medications, you want to eat a healthy, real food, protein-powered meal plan that has an appropriate caloric deficit and a balance of macronutrients for slow and controlled weight loss, aiming for 1 to 2 pounds a week to help to prevent muscle loss. And Dr. Andrew Huberman teaches that in addition to making sure that you're eating enough protein, you have to incorporate 2 to 3 days of resistance training per week to help prevent muscle loss during weight loss, just as you do during the transition to menopause. For women over 40 who are using these medications or who are not using these medications, we're trying to protect our muscle. And so we want to eat enough protein. We want to make sure we're doing resistance training. So I want to clear up some common myths and misconceptions about these medications. First, GLP-1 medications are not addictive. In fact, these medications don't activate that dopamine pathway in your brain's reward circuit, like addictive substances do. According to a 2023 review in Nature Reviews Drug Discovery, GLP-1 receptor agonists work through satiety and metabolic signaling, making your stomach feel full, not by hijacking your brain's reward systems. They work on your brain and your stomach, quieting brain chatter, but they also affect cells in your stomach to signal fullness. So when you stop taking them, your hunger and your brain chatter that you normally have will resume. But if you are in a maintenance phase and you've already gone through that weight loss phase, it's going to be a lot easier to manage. Another myth is that you'll always regain all of the weight once you stop. The Step 4 trial cited in the New England Journal of Medicine in 2021 found that patients who stopped semaglutide and returned to old eating habits regained most of their weight over the next 48 weeks, which is not because of the medication. It's because, again, like we talked about before, they didn't maintain their nutrition and exercise habits. Like we talked about as well, many people do gain weight after stopping GLP-1 therapy, but research shows that this is typically due to the absence of those long-term behavioral and lifestyle changes, not a rebound from the drug itself. And then finally, a misconception is that it's an easy way out. What's true is that GLP medications are most effective when they're combined with a comprehensive behavior change. It's not a shortcut. There is no way around addressing your relationship with food. In fact, research published in Obesity in 2023 indicated that individuals who paired GLP-1 therapy with dietary guidance and exercise achieved significantly better outcomes than those who were relying on the medication alone. So lasting success requires intentional nutrition, resistance training, stress regulation, and mindset work, whether or not you use the medication. The most common side effects of taking these drugs are nausea, vomiting, constipation, and diarrhea. According to clinical trial data, up to 44% of patients can experience these symptoms, and many people stop these medications at within 2 months because of the side effects. In most cases, they are transient, meaning that they'll resolve over time. Your body can get used to it. These are typically mild to moderate, and they often improve with that slow titration and the use of the lowest effective dose, meaning that you just start at a very low dose and you increase it slowly, and that can help to avoid the side effects. I recently heard an expert podcast that talked about how half of the patients discontinue these drugs due to those gastrointestinal side effects, usually within 2 months. But he said that he thinks that it can be because they were on too high of a dose too fast, and that slowly weaning onto the medications can decrease that gastrointestinal issue, and that many people get used to it. So one of the more serious but rare side effects that you've heard about is pancreatitis, which is just inflammation of the pancreas. It's really a serious illness. In clinical trials, the incidence of this was estimated to be 0.3% to 0.5%. So while the risk is really low, it's still important to just be aware of some of the symptoms like persistent abdominal pain, severe abdominal pain, and you definitely would want to seek immediate medical attention if that occurs. One of the experts that I listened to recently on a podcast wonders if people that experience pancreatitis who are taking these drugs are the people using it unsafely and dropping weight, dropping body fat way too fast. GLP-1 medications also carry warnings about potential risks of gallbladder disease, including gallstones, again, especially with rapid weight loss. So that's why you want to take a slow, controlled approach with a weighed and measured meal plan to help to avoid this and make sure you're drinking a lot of water. There's also a boxed warning for thyroid C-cell tumors based on rodent studies, although it hasn't been observed in humans. People with a personal or family history of medullary thyroid carcinoma should not take these medications. That's a contraindication. So it's important to discuss your full medical history and your risk factors with your provider before starting a GLP-1 medication. You have to weigh the risks and the benefits and consider the risk of continuing to be obese. That also, as we know, has a lot of risks. Many people die every year from diet-related diseases, and that also, as we know, has a lot of risks. Millions of people die every year because of preventable diet-related diseases. Another barrier to this medication is that it's cost prohibitive, it's expensive. It can range from $900 to $1,300 a month without insurance. With insurance, it can be as low as $25. Insurance may cover it for you if you have a qualifying condition. So if you are obese with a BMI over 30 or overweight with a BMI more than 27 with comorbidities like diabetes, hypertension, or sleep apnea. But if you don't qualify for that because you're using it for weight loss and you don't have comorbidities yet, you'll have to pay out of pocket. And that's why many people use compounding pharmacies. But you want to proceed with caution. A compounding pharmacy makes it themselves, so it's not directly from the manufacturer. Some states allow legally compounded semaglutide and tirzepatide from these compounding pharmacies, making it more affordable at $100 to $500 a month, depending on your dosage. I know Utah does, but the risk is that products that are compounded outside of FDA oversight may not be safe or effective. So you want to be sure what you're putting into your body. You want to make sure that you're using a good compounding pharmacy and definitely avoid sourcing these medications from non-US or unverified pharmacies. Like I mentioned before, I have a client, one of my longtime clients who's been living sugar and flour free for years, but was struggling to stay consistent with her plan because of life stress. She recently started a GLP-1 medication under the care of her medical provider. And the result has been that her food chatter has quieted, making it easier to follow her healthy real food meal plan and create her habit stacks consistently. I've done a massive amount of research about these drugs, and I encourage you to do the same. I also explored this option for a close family member that I love who is dangerously obese and has struggled to implement a healthy real food lifestyle despite having a really strong desire to follow a sugar and flour free meal plan. These people are not weak. We all know that food addiction is real and that our brains are designed to block us from weight loss. And while we can experience a lot of the benefits of taking these sorts of drugs without taking them by living sugar and flour free and weighing it and measuring our food, we can experience the decreased food chatter and decreased hunger without medications, as many people have, just by removing addictive foods from our diet and again, weighing and measuring our food, because it quiets down the reward center of our brain. And when we stabilize our blood sugars on a sugar and flour free lifestyle, it decreases our insulin, so our leptin comes back on board, that hormone that makes us feel full and want to move. But even with all of that, some people still need additional support and have trouble being consistent with it and sticking to it, especially during the weight loss phase. And there's absolutely no shame in taking these medications. When used under medical supervision, GLP-1 medications, which have been proven safe with relatively minimal side effects, can be like a bridge to help reduce your cravings and mental noise during the weight loss phase while someone begins to implement these new habits and build a new identity. The benefits may outweigh the risks in those cases. So many people worry about those gastrointestinal side effects, but from what I understand, when you wean onto the medication slowly and use the minimal effective appropriate dose, those side effects can be mitigated. Millions of people have been on these medications for years now. Pancreatitis is extremely rare and probably more prevalent again with people who are using them the wrong way with super rapid fat loss. But when you use these medications with a weighed and measured meal plan and titrate the medication and your meal plan so that you're losing 1 to 2 pounds a week, that is definitely going to decrease your risk of negative side effects and muscle loss. So there's no shame in using these medications like GLP-1 that have been found to be safe with minimal side effects to help you decrease your food chatter and hunger while you start implementing these lifestyle changes and creating your new identity. In fact, it may be a really helpful tool to aid you in your journey when used the right way with the right lifestyle mindset. And I want to be real with you. I'm considering it for myself as well. When I first started this journey in 2020, I lost 125 pounds in less than a year by implementing a healthy real food lifestyle free from sugar and flour. So without medications, without surgery, that transformation changed my life and launched my calling as a coach. But in the almost 4 years since I've experienced that weight loss, the very real challenges of maintaining that weight loss while building a business and continuing to work at the hospital, managing stress, raising young kids, navigating my emotional health and anxiety. I've learned so much in these past 5 years and have remained consistent with my sugar and flour free lifestyle with very few exceptions. But I've also, because of minor exceptions, over time have experienced weight creep. And over the years, it's about 40 pounds. And I've worked through anxiety, emotional eating. I've learned to better regulate my nervous system and emotions without turning to food. I'm not binging anymore. A lot of the weight that I've gained is muscle too. I have been really consistent with my weight training and maintenance, which has really helped me to build muscle. Like I've shared openly over the years, part of the challenge that I've had was when I got to maintenance, not adding enough food to my maintenance plan initially, which led to being overly hungry and binging, which led to weight creep. And then returning to the caloric deficit to try to get that weight creep down. That caloric deficit has been a trigger for me for binging since I achieved maintenance. So for me, my main goal is to be free from binging. And more important than losing weight and getting back down to my original weight is to not binge. I'm really happy at the weight that I am right now. I'm super healthy. I am consistent with my meal plan. I haven't been binging for a long time. I'm not perfect. There are times when I deviate from my plan or make mistakes and practice course correction, just as we teach and talk about in our program. Practice all of those tools. I'm a person that experiences food addiction just like you. I'm just a little bit farther down the road. So I'm sharing this with you because for me, my thoughts about potentially using these medications are for the purpose of getting back down to the weight I want to be, a little bit lower, and decreasing my body fat. But in the past, that caloric deficit has been a trigger for binging. So having a tool that helps to take away the hunger and the cravings during that caloric deficit may potentially be beneficial for me. I don't know. I don't know if I'm going to use these or not. I've lost weight before. I know I can do it again without medications. But why not use a medication that makes it easier and has been proven to be safe? I don't know. If this is something I choose to do in the future, it would be a decision that I would make with my doctor and also with God. Anytime I'm making changes to my plan or making big decisions in my life, I always pray about it. And God has guided me every time. And I know that He could help guide me in this decision as well to know if it's right or to know if it's not. And He's the ultimate source of truth that I trust the most. There's no shame in using GLP-1s as a tool. When you use them wisely and intentionally, they're not a quick fix, they're not a replacement for the inner work, but they can reduce the food noise and help make the path to consistency a little bit clearer. If I do decide to try one, I'll be transparent with that about that process. I want to lead with integrity and I want to break the stigma around using medical tools when they're part of a well-rounded, thoughtful plan. And I'm grateful for all the struggles that I've had in maintenance because it's taught me so much, right? Like we always say, you never lose, you either win or you learn. And while I've made mistakes, they've been learning opportunities, and I've taken the time for the compassionate curiosity, and I've learned and I recognize how to be successful in maintenance. And I'm successful in maintaining my current weight. I've been here for over a year. I know that if I were to get down to a lower weight, I'd also be able to maintain that with the things that I've learned from my mistakes. GLP-1 medications are not for everyone. They are expensive, they come with potential side effects, and should always be used under medical supervision. But if you've done that inner work, committed to a healthy real food lifestyle, and you're still struggling, this may be a tool worth exploring with your doctor to help you to build that bridge to maintenance at a healthy weight. After doing extensive research, I feel confident and excited to share what I've learned with you so that you can make an informed decision, an empowered decision. I'm definitely not pushing these medications, but I'm also not against them. My mission is to simply provide you with honest, evidence-based education so you can decide what's right for your body and lose weight for the last time in a healthy and sustainable way. Before we wrap up, here's a quick summary of the key takeaways from today's episode. GLP-1s mimic a natural hormone in your body that regulates appetite, insulin, and blood sugar. Semaglutide and tirzepatide are FDA approved for weight loss and diabetes. They are safe and require adequate protein, strength training, and a healthy lifestyle. They do not cure obesity, but they help to treat it. They are not addictive. Weight regain after termination of these drugs happens when lifestyle change hasn't happened. And you want to work closely with and consult with your doctor to know if they're right for you. Be sure to use reputable pharmacies as well. You can lose weight for the last time without these medications, surgery, calorie counting, or relying on willpower. That's what I've been helping people to do for the past 4 years. But now this is a new tool to consider on your weight loss journey that wasn't available for this purpose 10 years ago. For my clients, I recommend a 10 to 30% caloric deficit. And when used in the right way, in conjunction with the right mindset and strategy, this may allow you to tolerate a slightly more aggressive caloric deficit up to that 30% so that you can see faster results than with a 10 to 20% deficit without the hunger and the cravings. The right plan, again, is the one that you can stick to, and this can help you to stick to your plan. Stay tuned. We're going to talk soon in a future Monday Mindset about science-backed strategies to help you to be successful in maintenance when you get the weight off with medications or without medications. I'm going to teach you what I learned from my mistakes, but also the science that we've learned from an extensive study from the Weight Control Registry, over 11,000 people who have maintained their weight, what they did to be successful long-term. But however you choose to approach your weight loss phase, the weight loss journey, the key is to ditch the diet mindset and adopt permanent lifestyle changes. So if you found this podcast helpful today, please subscribe, leave a review, and share it with a friend. I appreciate that so much. This week in our group coaching calls, I'll be happy to answer any of your questions about this tool. And if you're not in my coaching program yet, but have more questions and you're struggling with cravings or consistency, send me a direct message on Facebook Messenger. I would love to answer any additional questions that you have, hear your story, and help you to find the support that you need. Thanks so much for being here and for being part of a movement to pursue sustainable lifestyle transformation with healthy, real food. I'll see you next time. Thanks for listening today. If you enjoyed this podcast, you're going to love my coaching program. If you're struggling with your sugar and flour-free lifestyle and want to lose weight for the last time, I can help you. I guarantee that you achieve your goal body within a year, or I will coach you for free until you do. Just imagine living in your goal body and having peace with food. Your success is guaranteed. To learn more about how to get support, guidance, and accountability so you can find peace with food, achieve your goal body this year, and have more energy, visit www.healthyrealfood.com. While you're there, be sure to sign up for the upcoming free challenge to learn the Success Framework, and click the link to my schedule for a free 30-minute one-to-one coaching call so we can get you started on your success path. You have the power to create the life that you want. This is the year of you. I'm cheering you on. Now go win the day. You got this.